Okay, good morning everyone and welcome to our webinar on engaging older people, reflections from COVID-19. My name is Michael O'Connell, I'm chairperson of Cork City Partnership and will be chairing this event this morning. The event will focus on how the lessons we've learned through COVID-19 will impact on our approach to engaging with older people in the future. The event will also be recorded and anyone not able to stay will have access to it later on. We will have a question and answer session. If you want to post a question, there's a box on the webinar where you can post your question at any time during the morning. To officially open the event, I'm delighted to welcome our Lord Mayor, Councillor Colin Kelleher, to say a few words and to open the event. Thank you, Lord Mayor.
Thank you, Mr. Chairman, and good morning, all. Mr. Butler, former Lord Mayor and Mr. Chairman, Michael O'Connell, and members of the board, directors of the board of Cork City Partnership, and ladies and gentlemen. I'd also like to acknowledge Adrian Rogers, Cork City Council, Director of Community Culture and Placemaking. It's an honour to speak to you this morning in my capacity as Lord Mayor and open up this webinar to, I suppose, highlight Cork City's partnership for engaging with older people during the COVID pandemic. I noticed in the video there at the start of, I suppose, some of the highlights of the work that's been carried out by Cork City Partnership throughout the pandemic. And there was a picture there that struck me inside the chamber in Cork City Council. And former Lord Mayor, Councillor John Sheehan, receiving PPE on behalf of the Chinese community through the Cork City Partnership. And what stuck out most for me was the late Tony Power, who was, I suppose, pivotal in Cork City Council's engagement with inclusivity and inclusion and the community culture and placemaking. So it's unfortunate that Tony is no longer with us this morning, and I'd just like to pay my respects to him. And he is sorely missed in this area, particularly in the city. I suppose Cork City Partnership has worked and has supported older people for several years now, and this was made particularly highlighted through the COVID pandemic. He set up a call centre in call service in 2010, which I know is a friendly caller volunteer service for vulnerable people or persons who can contact you by phone and have a chat and just check in to see how a person is feeling. This service provides friendship and a sense of security and makes older people and older persons feel safer in their home. It's a credit to the board, and I know under the stewardship of Michael that you've only gone from strength to strength. During 2020, you saw a 70% increase in the numbers of the service, with just under 400 older people receiving a call on a daily basis at the peak of the pandemic, and a drop in numbers since then. Activities aimed at encourage social active and participation. Prior to COVID, Cork City Partnership supported several activities aimed at encouraging social participation for older people, including and organising a monthly Sunday tea dance. Now, I know that's probably gone by the wayside on account of the pandemic, but I know that, hopefully you will have that back soon enough as, we progress through this pandemic. I know the event here today will focus on what lessons you've learned through the COVID pandemic and how it will impact your approach to engaging with older people in the future. And as part of that event, through video clips we'll see here today, and you'll also show the experiences that you've experienced yourself, but also that the older people of Cork City has experienced. So again, on behalf of Cork City Council and the elected members of Cork City Council, and in my capacity as Lord Mayor, it's an honour and a privilege to be here with you this morning and to officially open up your webinar. You're on mute, Mike.
So our next speaker is Minister Mary Butler, TD. From 2016 to July 2020, Mary Butler was the Fianna Fáil spokesperson for older people and health promotion, working closely with the Alzheimer's Society, Age Action Nursing Homes Ireland and the Cares Association, as well as many other representative groups. She also chaired the All-Ireland Party Oireachtas group on dementia, raising awareness for people with memory difficulties as they grow older. In the last Dáil, she produced several pieces of legislation, including bills on fair deal and mandatory sentencing for crimes against older people. In July 2020, Mary was appointed Minister of State at the Department of Health with special responsibility for mental health and older people. Good morning, Minister, and you're very welcome.
Good morning, Michael, and thank you for that very warm welcome. It's lovely to be here with you all this morning, and listening to Michael and your lovely Cork accent. I have to say my own dad hailed from Drimoleague in West Cork, and it's lovely to hear that lovely soft tone. I miss it so much. We lost him 26 years ago, but it's lovely to hear. It's lovely to hear the Cork accent. I am delighted to be here today for this webinar on engaging older people, reflections of COVID-19. I would like to extend my sincere thanks to Cork City Partnership for inviting me here today, to you, Michael, Chairperson of CCP, and to my good friend and colleague, Lord Mayor of Cork, Councillor Colin Kelleher. Thank you for your opening remarks. I know everybody on the call are fully committed to strengthening communities in Cork and further enhancing services and supports, including our older population. And I would like to welcome all the participants that are listening in. There's a large number of people listening in, so everybody is more than welcome today. I would like from the outset to acknowledge the tremendous work of Cork City Partnership in providing advice, guidance and support to local communities in Cork for nearly 30 years. Building on existing programmes, the partnership has continued to provide crucial support to the older population in Cork throughout the pandemic. These supports, such as the friendly call service, have helped to alleviate the loneliness, the isolation that many people have experienced during this time. And what a difficult time it has been over the last 18 to 20 months. Maintaining physical and mental well-being has always been important, but as we have seen over the last 18 months, it is now more vital than ever. With the arrival of COVID-19 in early March 2020, the In This Together campaign was launched to support health and well-being during the challenging times. Building on the Keep Well Resilience campaign, which was launched in October 2020, €7 million was invested in this initiative to support a range of actions and support services. The campaign focuses on 5 main themes: keeping active, staying connected, switching off, eating well, and minding your mood. And I think those 5 key actions are something we should all aspire to every single day. The community call programme was introduced in mid-20 to provide local helplines through local authorities in order to deliver practical support, information sharing and befriending. And I do want to thank all the local authorities throughout the country who were absolutely to the fore in supporting the community call programme. The National Senior Alert Scheme, which Cork City Partnership delivers at local level, has enabled older people to live securely in their homes through the provision of personal monitored alarms. Befriending phone call initiatives and a national support line has also been provided through organisations such as Alone. These initiatives have benefited numerous older people in communities across Ireland and are of significant importance in building on existing plans and frameworks to effectively meet the needs of older people living in Ireland. And older people want to stay at home, they want to age well at home, and we need to have the correct wraparound supports in place for them. And the work that has been done by Cork City Partnership ensures that older people can live at home when they know those supports are in place. Also, older people can avail of many mental health services and supports listed on the HSE website, yourmentalhealth.ie. Information on available services is also provided through the free mental health telephone line 1800 111 888. And for example, free counselling and other mental health supports are being provided through groups such as My Mind, Turn to Me and Silver Cloud. Also, many of you would have heard the adverts that were put in place on local radio with the helpline numbers for people to engage with, because I'm acutely conscious that not every older person is online, and it's really important that they hear. And I was particularly strong on making sure that these adverts were rolled out on local radio, because we all know people listen to their local radio in the mornings especially. and that those numbers were there for people to pick up on. In recognition of the specific mental health needs of our older population, I secured dedicated funding as part of Budget 2022 to develop new mental health services for older people in line with the model of care for specialist mental health services, and this will be piloted next year. So we're all aware of ICPOP, the Integrated Care Programme for Older People, but when people avail of these services, and they are really, really good wraparound supports, there was no supports for people with mental illness. So I secured funding, so we roll out 3 pilots next year to integrate mental health supports with the ICPOP teams. As against duplicating services, I think it will be very important to do that. Also, I want to talk about the reopening of daycare centres for older people, because this has been an absolute priority following their closure last year. And we all know how important daycare centres are. They're fundamental to the health and well-being of our older population, and they play a key role for people to continue to live independently in their communities. So approximately 160 centres have reopened in communities across the country, and more will reopen in the coming months as quickly and as safely as possible. We have been challenged in a couple of areas. So where you have a standalone daycare centre that opens during the day, they were much easier to open in relation to infection prevention and control measures. But where we have daycare centres which are part of a long-term residential care facility, they have been more challenging to reopen because of capacity issues, having different exits and entrances, having a second, maybe a living area, a second dining room, because as we know, COVID, when it's prevalent in communities, it's prevalent everywhere. So we have had a few challenges in getting some of them open, but we are working really, really hard on it. As Michael said at the outset, when I was in the last Dáil, I chaired the All-Party Committee for Dementia. With Cork woman and Senator Colette Kelleher, we co-chaired it together, and we try to raise awareness as much as possible in relation to dementia. And it's something that I'm very happy to say in last year's budget and this year's budget, I was able to deliver on that. So this year, for example, €7.3 million in the budget will allow for further improvement of services, including in the areas of memory assessment, memory technology resource rooms, the implementation of the dementia registry, and dementia audit within acute hospitals, which is really important, and the National Intellectual Disability Memory Service. We know 11 people are diagnosed with dementia every day. I think there might be 11 people not diagnosed also every day. We're hearing that there's 64,000 people in the country with dementia, but I do think it's really important that we do have a dementia registry and that we have more concrete figures to back up what needs to be done. I'm really pleased that the proportion of new home support hours that will be ring-fenced for people with dementia will more than double from 5% in 2021 to 11% in 2022. Taken together, this will represent €15 million of investment dedicated to dementia in 22 to supplement the 12.9% that was allocated in 2021. I have long, as I said, advocated for the development of dementia services and was delighted to see this funding. Recently, I travelled to Tralee to open the 30th memory technology room in the country. Now, this is the first purpose-built one, and it's a fantastic facility on the Butler campus in Tralee. But to have now 30 memory technology rooms in the country, we're really moving in the right direction. Progress has also been made on the introduction of a statutory scheme to support older people to live in their own homes and provide equitable access to high quality regulated home care. A pilot on home care support is commencing in one site this week, with further pilot sites coming on stream in January 22. A National Home Support Office will be established before the end of the year. In addition, the recruitment of 130 posts have commenced this quarter for the national rollout of the Inter-Eye Ireland system, which will support the pilot to the standard assessment tool for care needs. So basically, I suppose, just to put it simply, we all are aware of what fair deal is, and fair deal means that you can age well in a nursing home. But what I'm putting in place is a statutory home care scheme similar to fair deal, that you can receive those supports at home. And we're piloting starting this week in one site and 3 sites in January. And this will really be helpful for us to determine exactly where the challenges are. Despite the challenges in delivery of home support, so I'm fully committed to ensure an improved delivery of home support hours in communities across the country. The 150 million funding secured in 2021 for 5 million additional hours of home support has also been maintained in 2022. We have challenges, and the challenges now are not in relation to budget for delivering home care. The challenges now are getting staff, and I know everybody is aware of that. So provisional data shows that at the end of August 2021, over 13.2 million home support hours were provided to 54,000 people. This is about 2 million more hours compared to the same period last year. Approximately 478 people were waiting for funding approval. Now, when I took over last year, there were 7,500 people waiting for funding approval. So this represents an 88% reduction compared to the same period. But as I have to say, again, I have the funding to support home care. Where we're challenged at the moment now is the recruitment of staff, of home care workers, especially in rural areas and especially at the weekends. I will continue to work with the HSE in collaboration with my department to increase these home care supports. Of note, action has been taken to develop a wider range of housing options for older people, which are age-friendly and focus on the will, the preference and the choice of the older person. This includes, for example, the development of a suite of age-friendly resources on housing and the launch of the Age Friendly Homes website. Before I conclude, I would like to take this opportunity to welcome the decision this week to extend the booster vaccine programme to all healthcare workers, including those in nursing homes and the older person services. This decision, along with the progress made to date on boosters, including the rollout to all those living in nursing homes and our older population in the community, will further protect our frontline health staff and the people under their care. It will also give our older people the confidence and protection to engage in their communities as societies continue to open. So could I encourage everyone to take up the booster shot when it's offered to them? I know a lot of people have already got it. And also the flu vaccine is so important as well. As we face into a winter of uncertainty in relation to COVID, in relation to the winter flu, in relation to the vomiting bug. Last year, for example, we didn't have either of those, and it made life an awful lot easier on people. Finally, I would like to thank all the volunteers who participate in the Friendly Call service, as well as all those who are involved in the many other schemes provided by Cork City Partnership. I always say we're a great country of volunteers. Where would we be without all the volunteers across all the different organisations, be it sporting, be it tidy towns, be it community services like your own. It's so important that we recognise the work that volunteers do on a daily basis. These people are making a real meaningful difference to the lives and communities of people, including our older population living in Cork. Your efforts and dedication during the pandemic are to be commended. And again, I want to give special thanks to Cork City Partnership for organising this excellent event, to the other speakers today, and to thank all those in attendance for taking the time to be here today and for your very warm welcome. I was honoured to be asked to speak here today. Gorv Míle Maith. Michael, you're on mute.
I was just thanking the Minister for her kind remarks, and I know today is an exceptionally busy day for you, Minister, so we're delighted that you were able to take time out to join us and to invite you to Cork anytime you would like to come back down. We'll be more than delighted to see you. Thanks very much. So our next speaker is Dr. Mark Ward. Dr. Mark Ward is a research fellow with TILDA. Mark works on the Healthy and Positive Ageing Initiative project, which is jointly funded by the Atlantic Philanthropies, Department of Health, the Health Service Executive and Age Friendly Ireland. Prior to joining TILDA in 2016, Mark was Assistant Professor in the Department of Sociology, Trinity College. He has also conducted research for a range of organisations, including the Health Research Board, the Royal College of Surgeons in Ireland, Focus Ireland, and the Tobacco Free Research Institute. Mark was the lead author of Alternative Lives in a Time of Crisis, the impact of COVID-19 pandemic on the lives of older adults in Ireland. You're very welcome, Mark, this morning.
Good morning, and thank you, Michael, and thank you, Linda, and the CCP for giving the opportunity to speak today. It's always great for us to get the opportunity to share what we've learned from our research. And also just to say, it's a really great attendance this morning. I think it shows there's a real hunger and willingness among people to kind of learn lessons from our experience over the course of COVID. So hopefully I can shed some light on that for people as well. So if you bear with me one moment, I'll just share my screen. So hopefully everybody can see the slide deck there. So what I am going to do over the course of about the next 40 minutes is essentially, before we begin, I kind of want to just set up where we were before COVID and the types of things that we've learned about the lives of older adults over the last number of years. Then just give you a brief introduction to the study that I work on, which is the Irish Longitudinal Study on Aging. And then, as Michael referred to, I'm going to describe some of the findings that we have from a couple of studies that we conducted during the summer of 2020, so in the early months of the COVID pandemic. And then hopefully, as we reflect on some of those findings, we can start thinking about how we can improve or continue to improve the lives of older adults as we hopefully emerge from the pandemic. So before kind of describing the study itself, I wanted to highlight one of the kind of key things that we do, that we have done over the last number of years, is kind of highlight the contribution that older adults make to their families and their communities. And I was delighted that the Minister highlighted the role of volunteering, because we find a high proportion of older adults volunteer very regularly. And from our study, we find that almost 1 in 5 people aged over 50 volunteer at least weekly. And the number who volunteer at some stage over the course of an average year is close to 50%. And that makes a huge contribution to people's lives. And that includes things like volunteers with the CCP, organizations like Alone, the sporting organizations, and so on. And I think sometimes that isn't highlighted enough, the time that people give to others freely. And what we also find around volunteering is that the volunteers themselves benefit greatly from participating in volunteer activities. And what I mean by benefit, not like mental health is better, physical health is better, and importantly, people's quality of life and kind of sense of purpose is better when they do take the opportunity to volunteer. We also have found that, you know, a large proportion of older adults are very socially active. So almost 2/3 take part in social activities on a weekly basis. And that can be anything from, you know, just meeting friends in coffee shops or bars or whatever, eating out, going to the cinema and so on. So people remain very active into their old age. And again, just to emphasize, like, this is social participation, social engagement, volunteering, strong relationships with family and friends and so on have huge benefits for people's mental and physical health. Just one more thing to kind of highlight here is the amount of childcare provided by older adults. So we found that 41% provided childcare to grandchildren on a regular basis. And that number increased massively during the COVID pandemic, when people who had to still attend work in person didn't have recourse or access to childcare facilities and so on. So I suppose to summarize this, you know, pre-COVID pandemic, older adults very active, very socially engaged, and make a huge contribution to their communities and their families. So if you want to put some real numbers on those, I suppose, so this focuses on people over 70 years of age. So over 130,000 people provided regular care for their spouses or relatives and friends and so on. 131,000 of those over the age of 70 provided regular care for grandchildren. over 200,000 volunteered in the last week, and of those 75,000 volunteered every week, which is a really phenomenal number when you think about it. So I'm going to briefly give you an introduction to, or an overview of the Irish Longitudinal Study on Aging, and then I'll walk you through some of the findings that we have from during the COVID pandemic. So TILDA began life in 2009, where 8,500 people aged 50 years and older were recruited from throughout the country. So you can see in that map there, the participants are spread throughout the country, so cities and rural areas. And it's a nationally representative sample, which means that, you know, what we find among these participants is also typical of the wider population. So when we're collecting our data, we do three things. So one is an interviewer goes to the home of the older person and conducts a face-to-face interview with them. And just here I want to emphasize that the contribution of the time the participants give to this study is really phenomenal. So that interview alone takes in the region of 2.5 hours. And you'll see in a moment the breadth of the information that people provide us with. And people are also then complete a self-completion questionnaire. So we leave a questionnaire booklet in the person's home, which they complete on their own time. And that's to collect information on kind of what be considered more sensitive information around things like maybe childhood experiences, mental health, alcohol use, and so on. And then we also conduct a full health assessment where participants attend Trinity College, a health assessment centre there, or a nurse visits them at home and they go through a raft of physical assessments. So having been going in 2009, then we collect information every 2 years. And the important thing here is we visit the same people every time. So what that means is we can really track change over time and identify the types of things you know, that help people maintain healthy lives well into older age. So our last kind of full round of data collection was in 2018, and we were due to collect data in 2020, but that had to be postponed due to the pandemic, as of course interviewers couldn't visit people's homes and so on. So we're currently conducting that wave or that round of data collection now. So just to give you an idea of the breadth of information that participants provide us with. So, you know, they tell us things like around their marital status and household structure, the quality of their relationships, tell us about their social activities, their day-to-day lives, their working lives, and whether working now or previously, details about their retirement, their income. And we collect a lot of information on people's mental health and physical health, as well as their diet and things like that. So we really do get like a very full view of people's lives. And again, we can only do that due to the, you know, the willingness of participants to commit so much time to the study. So when COVID started in March 2020, we kind of immediately repurposed everything so as to use the information that we already had collected to try and inform responses to the pandemic. So this is for the immediate responses to the pandemic. So we kind of identified the most vulnerable groups and people with high risk categories and so on. So we try and understand that, document kind of levels of physical activity and the importance of that to people's lives. And the thing that's of particular interest to me was around the issue of loneliness and isolation, because even at that early stage, we had a strong sense that the types of restrictions being put on people's daily lives was likely to have a dramatic impact on levels of loneliness and people's feelings of isolation. So in May 2020, we secured money from the Health Research Board to survey TILDA participants to try and understand how they were experiencing the COVID pandemic in the early months. So to do that, we posted questionnaires to our participants, and almost 4,000 participants returned completed questionnaires to us over the preceding months. So in January of 2021, we launched kind of a headline report with the main findings from that study. And I've provided links if people want to download the report themselves at the end of the presentation, which I think Linda will make available to everybody. So the topics we covered in that report were people's changes to their everyday activities and kind of levels of concern people had around COVID and whether they or any of their friends or family had contracted the virus at that stage. We also looked in detail at loneliness and social isolation. We looked at physical activity, sedentary behaviour, and a number of measures of people's mental health and well-being, which I'll go into more detail in a second. We also tried to gauge the level of kind of missed healthcare appointments that people have, because obviously a lot of services were not available, and also the use of medication and health supplements, including vitamin D, which people might have seen got a lot of media attention. And finally, we also looked at changes to people's caregiving roles, as a lot of people kind of stepped in to fill the gap in service provision for things like childcare and looking after people's spouses and other family members. So just going to give you kind of a whistle-stop tour now, some of the main findings around people's experience of the pandemic. And again, I want to emphasize that, you know, this data was collected between July and November of 2020. So if any of us can remember that long ago, that was kind of the earlier months of the pandemic. So there were quite strict restrictions in place, but the case numbers, looking back at them now, were quite low. The idea of vaccines was only in its infancy, so they were only in early development and so on. So it was a much, I suppose, different situation than we're in, than we're in now, or have been for the last few months. So in terms of adherence to the public health guidelines around social distancing and mask wearing and so on, so we found there was really high compliance with those guidelines. So almost everybody reported that they were, washing their hands more frequently than before. Over 90% using hand sanitizer and disinfectant and so on. Almost everybody far more conscious of the symptoms for COVID, which, as we know, are not dissimilar to those for the common cold. And 3/4 of people also wore protective face masks when they were outside with others. So in terms of social distancing then, as I said, the really high compliance rate. We did find that women were slightly more likely to socially distance when they were with others compared to men. And that was similar among the over and under 70s. And just what I mentioned, that age card, so as we all know, the over 70s were asked to, unfortunate word, of cocooning. And what we found was that the levels of compliance and so on were similar between the under and over 70s. We'll come back to that in a second. So, as I said, one of the things I'm really interested in is loneliness. And we've done a lot of work around this top area before COVID. And I work alongside Alone and also the Loneliness Task Force and so on. So even before COVID, it was seen as an increasingly important public health issue. And that's obviously, like a lot of things, been amplified by our experience during COVID. So this slide is a little technical, but basically we use a measure of loneliness where people are assigned a score from 0 to 10, with 10 being kind of most lonely, and 0 being not lonely at all. So if you see the grayscale bar chart there, this is before COVID. And if you just look at the bar on the far left-hand side, you'll see most older adults didn't experience any loneliness at all at that stage. And then you get smaller numbers experiencing more loneliness as you go across the scale. On the right-hand side is the same measure, but recorded during the early months of COVID. And hopefully you can see there a massive shift or increase in loneliness across the population of older adults in Ireland. And it's really unusual to see such a massive change in something like that over such a short period of time. So another way to look at that here is, if we look at the graph on the right-hand side there, so the 4 that would have been data, the average loneliness score in 2016, the next time point was average loneliness 2018, and the third was 2020, so during COVID. And we can see that levels of loneliness, and you could extend this back for a further 10 years, were pretty constant across time, so it doesn't fluctuate much. But with the onset of the COVID pandemic, it really shot up. So an awful lot more people experience loneliness due to the increased social isolation. And we know that loneliness is bad for people's mental health, it's bad for their physical health. And we've even shown among TILDA participants that it's associated with premature mortality. So that trend is, I suppose I can't emphasize much just how worrying it is. So we also collected information on levels of chronic stress, and you see a similar pattern here where average levels of chronic stress are pretty constant over time, didn't increase. And again, you could bring that back another 10 years and you'd see the same pattern. And then we see that inflection point again brought on by COVID. So again, chronic stress levels among older adults increased massively in the early months of the pandemic. Looking at depression then, same pattern, and you could really look at any of the mental health measures that we have here and you'll see a similar pattern. So again, among both men and women, levels of clinical depression were a little less than 10% in previous years, and then they shot up when the COVID pandemic started. So if you see in that table at the bottom, so the average, the percentage of older adults with clinically significant depressive symptoms was close to 5% among men in 2016 and 18, and around 8% in women in the same years. And that increased threefold with the onset of the pandemic. So, it's as clear as day, and I'm sure everybody had a sense of this themselves from their own experiences and people they know, that the pandemic has had a really dramatic and negative impact on people's mental health. And just one final kind of headline result from that study. So essentially what we found, as I alluded to earlier on, a lot of older adults had to step in to fill the gap around both childcare, but also caring for spouses or other elderly or older relatives and neighbours and so on. And almost 1 in 5 people under the age of 70 in this study took on new caring roles that they hadn't had before the pandemic began. So this is kind of the main, or summary of the main survey results, and I'd encourage people to have a look at that report themselves, and indeed the other reports that we published around that time. But what we also did, which was kind of out of the norm for us typically, but we were conscious of kind of providing people with the opportunity to tell us in their own words how they were experiencing COVID, because I think people's stories can sometimes get lost somewhat behind the big figures that I was just reporting there. So we included a couple of questions and provided people with a couple of pages to fill in their responses. So basically asked them how they were experiencing COVID, and also asked them what their kind of hopes were for the future. So we collated all of that information, which is a huge amount of information if you think of 4,000 people's stories. And we've done our best to kind of summarize the main themes or topics that people spoke about. And the four of those were normality, resilience, isolation, of course, and then their hope and optimism for the future. And again, you can download this report from the TILDA website, and I've provided links at the end. So in terms of normality, so a number of participants emphasized the dramatic impact that the COVID pandemic and particularly the restrictions had on their normal daily lives, and they expressed a lot of frustration about the changes that that happened to their lives over that time. Many also commented on the effect that the pandemic had on their normal religious practices, and particularly around funerals, or not being able to attend funerals, which was really difficult for people. And you can see an example of that from an 80-year-old lady, and she spoke to the sadness of not being able to attend funerals or sympathise with families over the loss of their loved ones. And that was a very common theme among a lot of the participants. So in terms of resilience then, a lot of people were conscious of the fact that they kind of saw themselves and saw different groups as being demonstrating the capacity to kind of get on with life as best as they can and adapt to the new normal, if you like, during the early months of the pandemic. And that included things where people kind of became more physically active or took up new hobbies. DIY was a big thing, and gardening and so on. So a lot of people kind of told us how they quickly adapted to the types of restrictions and found other ways to keep active and keep engaged, and I suppose to have a purpose in their daily, in their daily lives. So obviously social isolation was a massive topic for people, and for many that was the greatest challenge that they faced, and the effect of increase of isolation, of course, was a much greater sense of loneliness for among people. So unable to meet their friends as they typically would, unable to meet with family, and so on. And around this topic as well, the word cocooning came out as a real bugbear for many, many people. And I think if you see on the right hand side there, a lady, Laura, who's age 73, kind of sums it up perfectly. She said she resented the singling out of the aged and older for cocooning. It's not age as such which is relevant, but frailty and weak immune system and so on. And many, many people in their over 70s really struggled to understand why, when they were in good health or whatever, they were being, they were kind of having to adhere to the strictest restrictions to their lives. With many people telling us, for example, that they knew of people, in their 50s, but in very poor health and so on, and they were, in their eyes, allowed to kind of go about their business, whereas a healthy 72-year-old or whatever was being asked to stay at home. And again, I suppose that word cocooning just came out time and time again as really loaded, and I suppose people just didn't kind of get, where that came from. So to finish on a slightly optimistic, it's probably a bit stronger word, but hopeful note from the kind of stories that people told us. So people did tell us about what they look forward to when we hopefully come to the end of the pandemic. And of course, the main things they were looking forward to getting back to their old activities and so on, and, you know, returning to normal with their family and friends and so on. But a lot of people also emphasize, which kind of ties into the theme of reflecting on our experiences of the pandemic here. A lot of people expressed the hope that we kind of learned lessons from COVID. So one of the things I think that the pandemic did was that it highlighted a lot of, let's say, pressure points or weaknesses or cracks in society and in public policy and health policy and so on. And it emphasized the kind of issues around, say, childcare or access to healthcare services. And a lot of people expressed the hope that we kind of sat up and learn from our experiences of those things and kind of make them better. Now, whether or not that'll happen, I suppose we'll have to wait and see. So to briefly reflect on some of those points. So obviously the pandemic had a really negative and dramatic effect on the well-being of older adults. So question is, for us now, I suppose, will things just return to normal or will they last beyond now? My own sense is that some people will bounce back better than others, but I think it has created a lot of probably so far unmet need among older adults, which will need to be addressed. And that's probably reflected in the CCP's friendly call service. We would have seen a dramatic increase in the number of supports being provided during COVID. And I think it was Michael earlier on referred to the fact that that demand is starting to decrease, but whether that returns to what it was pre-COVID or not is still unclear. So we've been collecting information from these same participants over the last number of months, and that will give us some indication of, you know, how people have bounced back from the experience of the strictest restrictions, and hopefully we'll be able to identify those who haven't quite recovered quite as quickly, and to identify the factors associated with better outcomes that we can inform and policy, and hopefully organisations such as the Cork City Partnership can take on board for their own work. So secondly then, we've shown already before the pandemic just how important people's social connections and activities are to their well-being. And I think that is much clearer now. When you take those connections and activities away from people, you can see just how dramatic an impact it can have on their lives and their well-being. So this is one of the things I hope we bear in mind as we go forward and try and create as many opportunities and support people's efforts to maintain good relationships and to stay active well into old age. So the pandemic has also magnified what I would say were existing inequalities, or I think I might refer to them as kind of pressure points in society earlier on. So it emphasised, it kind of magnified the role of carers and the amount of the contribution that older adults make to caring within society, oftentimes in the absence of things like affordable childcare and so on. And it also emphasised equality in terms of frontline workers, including healthcare staff, retail staff, and so on. So often lowly paid jobs, and these were the people who still had to go into work and work face to face, whereas I suppose people like me could work at home quite safely. And then again, in terms of, I suppose, aspirations or hope for the future. So a lot of our participants express hope that there might be some positives from the pandemic, and that as we come out of this, that people remember just how important things like family and friends are to us, and how I suppose awful it is when you know, opportunities to keep those relationships strong and healthy are taken from us. But also just want to emphasize just how important things like Cork City Partnership's friendly call service and similar services like the loans, the friending service have been for tens of thousands of older adults during the pandemic. So I suppose I'll take the opportunity to thank Michael and Linda and the volunteers in CCP, because we know through work with it alone and so on that was really a really important kind of safety measure line for a lot of older people who didn't have many supports. And so hopefully that's kind of given some food for thought. I think if I was to summarize in one line, you know, I'd say keep doing what you're doing in the likes of Cork City Partnership. It really is an essential service. I think as we go forward, I hope the important role that community groups play in the lives of older people is clear for everyone to see now, and I hope that they'll continue to be well supported and even better supported into the future. So I will stop now, just again to say I've provided links to many of our publications, so please do reach out to us or go and download those if you want to get more detailed information from any of those studies. And just to acknowledge our funders as well, so the Department of Health, Atlantic Philanthropies, and then the Health Research Board and others. So thank you.
Thanks very much for that, Mark, for a very comprehensive and interesting report. As Mark has said, they're available to download on their site, and also they'll be available through Cork City Partnership channels, as well as we're recording the event here this morning. Mark is staying with us and will be part of the Q&A panel later on this morning. So if anybody has any questions, you can post them on the site, and then we'll get through them as fast as we can later on. Our next item is a video clip. We're going to show a video of John. John has been a client of our friendly call service since 2011. And in the video, he talks about the service and the support that he received from Cork City Council and Cork City Partnership. John is not originally from Cork and has little contact with his family living elsewhere. So we might play the video there now, thanks.
Cork City Partnership, they used to call to me fairly often. There was meals and things, and helped me when I was inside in the hospital, because all my clothes were burnt. They would all had to be destroyed. And they looked after me in regard to pajamas and things like that inside. So I'm in Cork a good while, and I have no family in Cork. And no one knew what I had COVID, or I was in the hospital. So, Cork Partnership done a lot of help for me, give me a lot of help through the COVID. And through the house I had, there was no running water in the house, so the tile in the bedroom wasn't working. And they're doing a lot of work in getting that done for me. There a few weeks ago, I got a cotton tablet from Cork City Partnership. And I find it very, very interesting there. I have can get the papers and boom.
Zoom, you're on Zoom.
And I can get
You're doing classes.
I'm learning on it.
Yeah.
Slowly, but getting there. And it's a great help.
And a new outlet, isn't it?
It's a new way, I'm learning it slowly, but getting there. Anyway.
That's good.
Yeah, it was great to see John doing so well. As I said, he's been 11 years in Cork, dealing with Coxley Partnership, and it was great to see him doing well. And just on the Acorn team, we have distributed numerous Acorn tablets to people all over the city. Again, as part of the pandemic, there's been a huge difference in some of their lives. You know, they can make contact with people and read papers and stuff like that. Okay, so our next speaker, ladies and gentlemen, is Dr. Fiona Reardon. Dr. Fiona Reardon is a senior postdoctoral researcher in the School of Public Health, UCC. Her research interests include implementation science, quality improvement, chronic disease management, and integrated care. Currently, Fiona works on the customized project, which aims to explore the process and impact of tailoring strategies to implement evidence-based interventions. In 2021, she's been working on the LINK project to understand the implementation of Friendly Call Cork during the COVID-19 pandemic and how it works with the community healthcare services. Fiona holds a PhD in Health Services Research and a Master's in Public Health. Good morning, Fiona.
Hi, thanks very much, Michael, and thanks for inviting me to speak today. It's really great to be able to present a little bit on the project. So I'll just try and share my screen now, so hopefully this will work. There's always a little bit of delay in trying to share screens. So yeah, so hopefully you should be able to see that now. Let me know if you can't see it, but so thanks very much for giving me the chance to present a little bit on the LINK project. So I'm presenting this on behalf of our team. So Tanya is our research assistant, Dervla is a master's student who was working with the project for the last few months, and Dr. Sheena McHugh is our principal investigator. So I want to talk briefly just about how the project came about. So back in March 2020, which feels like quite a long time ago now, I started volunteering with Friendly Call. So like many organisations, UCC had moved to working remotely. When I saw the call out for volunteering, it seemed like something that I could do while working from home. And I suppose through volunteering and through doing calls myself and through linking in with Brenda and the rest of the Friendly Call team, I learned a bit more about the service, and I really kind of got a sense from doing the calls of the difference that they could make to people. I think that was particularly true during the first lockdown, which was a particularly difficult time, I think, for people attending the service. And so as I was volunteering, I was reading a bit more about befriending services in general. We know that loneliness and socialisation is a public health issue. It's only become kind of more to the fore, I suppose, as a result of the pandemic. And there is research out there to suggest that befriending services can improve well-being and quality of life and also reduce loneliness. But I suppose from reading about befriending services in the Irish context, I suppose the research around that is growing, but there's still quite limited research. And really, Brian Lawler in Trinity and Joanna McHugh in Maynooth would be kind of more at the forefront of that research, looking at services like Alone. And I suppose in the context of Sláintecare, my sense was that it's really important, I suppose, to understand how these services work, and particularly how they link in with community healthcare services. We know that Sláintecare is really focused on developing community-based models of care, on integrating social and healthcare, and establishing links with the voluntary sector to develop models of care around older people and people with chronic conditions. And so I suppose from our perspective, coming from the kind of integrated care background, from the implementation science background, we felt there's maybe an opportunity there to look at how Friendly Call as a key service during the pandemic was implemented. And I suppose also how it integrates and how it links in with other services in the community. And so I talked to Brenda and Jackie from Friendly Call about this, and they were happy for us to put in an application for a new Foundations Award, and we were lucky that we were successful in that. So we started officially in May when Tanya came on board as the research assistant. And the project is very much kind of ongoing, so we're kind of in the middle of it. And we're broadly looking at, I suppose, these four things. So we're trying to understand how the service has been implemented during COVID and how that's worked. We're trying to understand how the service links in with community healthcare services and how referrals to and from the service work. We're trying to understand the kind of supports that are provided by volunteers and identify any needs from their perspective. And then the part that Dervla, our master's student, would have taken the lead on was exploring client experiences of the service before and during COVID. So she would have interviewed people who were new to the service and people who had been with the service for a while. And so in the interest of time, I'm not going to try and cover all the results, and we're still kind of very much in kind of the middle of the project, but I'll talk a little bit about maybe volunteer coordinator perspectives of how the service has been implemented and their experiences, and also then client experiences of the service during COVID. So I suppose briefly what's involved in the project, from our perspective, it's interviewing, conducting interviews with coordinators of the service, focus groups with volunteers. As I said, Dervla would have been interviewing new and older clients of the service. And we've also done interviews with a number of healthcare professionals in the community from different disciplines, and we're hoping to do more healthcare professional interviews, particularly public health nursing, if we can. And the point we're at the moment is that we have some preliminary findings, some initial findings that we're hoping to present at a workshop next week with key stakeholders. And the idea is that we would talk through what works well with the service, you know, some of the challenges, and maybe identify together some kind of actions that might work for the service. And our aim then ultimately is to be able to write up the report and launch that early next year. So that's kind of where we're at the moment in terms of the project. So in terms of implementation during COVID then, and really from the coordinator perspective, during the pandemic, there was really an opportunity to capitalise on some of the, I suppose, the long-standing and the quality relationships that already existed within the service and with other agencies and organisations that Friendly Call we're used to working with. And the pandemic also presented an opportunity to strengthen relationships with our agencies and community services, because there was really this onus on everybody working together, pulling together during the pandemic around people to support people. The pandemic also presented an opportunity to build existing knowledge. So as one of the coordinators flagged, you know, they were learning more about who to go to for different things. And ultimately, that knowledge of what agencies to go to and what organisations to link in with would impact on clients in terms of being able to solve issues and resolve issues for those people quicker. Because the Friendly Call service is so embedded in the community, with great reach to people who might be vulnerable and people with physical and mental disabilities who need support, I suppose I would frame it as its role during the pandemic as taking on a role of the distribution channel. So being a kind of a core channel for things like the City Council to deliver care packages to people who need them in the community. And they also scaled up a lot of the practical support that the service would have already provided. So adding on extra services like collecting prescriptions or shopping for people, or offering transport to medical appointments, and upscaling those aspects of the service. And then lastly, there was a lot more case finding during COVID. So the service implemented an active advertising campaign at the start of the pandemic, and they're really finding additional people who needed the service who maybe hadn't been identified or hadn't been aware of the service before now. And there was a sense also that maybe the people being identified now might be younger people, or might be people more with mental health issues who are being referred into the service. So from the volunteer perspective then, so we have focus groups with both new volunteers who joined during COVID and also volunteers who've been volunteering for quite some time with the service. There was a sense that it was quite a rewarding experience, and I know this ties in with some of what we heard already today about the experience of volunteering. And I really like this quote from one of the new volunteers, that, you know, they felt it really makes a difference in their own life to volunteer and to be linking in and phoning clients of the service. In terms of the conversations that people were having during COVID, there was a sense both from volunteers and coordinators who were calling clients that maybe the conversations had changed during COVID, or there was kind of more focus on things like helping people to register for vaccines or where to go for information about that, flagging things like, you know, if people are getting out for their daily walk and whether they're taking exercise, and also signposting things like new services, the fact that, you know, supermarkets were offering certain delivery of shopping. I thought it was really interesting that one of the volunteers flagged that she felt, you know, there was a lot more focus on necessity earlier in the pandemic. People were kind of focused on things like getting their prescriptions or getting their shopping and practical things like that. And then later in the pandemic, there was more of a shift to the digital issues. We just saw from John there that he had access to a new tablet now, and so I think that kind of reflects the experience of maybe lots of clients that they were trying to expand their connection with the world later in the pandemic and looking for other avenues to do that. And then some volunteers also spoke of, I suppose, their role in bolstering clients. So really encouraging people who maybe had lost their nerve during COVID to get out and engage with their community. And so they saw themselves as having conversations around that as well during the pandemic. And then lastly, volunteers flagged some of the additional supports they would find beneficial into the future. And for those working remotely, maybe during COVID, that was being able to link in with other volunteers. And also, although not everybody was calling clients who might have mental health issues, those who were felt it would be helpful to have additional supports there in terms of managing those calls and being able to advise people on those calls. So lastly then, from the client perspectives, so as I said, Ursula, for her master's, she interviewed both new clients and clients who've been with the service for a while. And when they spoke about the reason for joining the service, really it could be all kind of, I suppose, captured or encapsulated as replacing lost connections. And so those connections could be lost through bereavement, through the ill health of a family member or themselves, or through social isolation brought on by the public health restrictions during COVID. And being able to link in with the service ultimately meant for clients some level of reassurance and some reduction in loneliness. So as one of the clients says here, they found it really nice to be able to speak to somebody on the phone, even just about the fear of COVID and about the changing guidelines, and that was beneficial for them. When clients talked about the support they received from Friendly Call, I suppose they flagged that it was responsive to their needs, be it practical or be emotional. In a practical sense, being linked in with the service meant that you had access to things that I've already mentioned, like getting your prescriptions collected, but also getting transport to medical appointments, and that was something that was kind of flagged as important when the restrictions were placed on public transport at a certain point during the pandemic. An emotional support sense, being linked in, was also flagged as something that might give them a boost or the courage to engage with things in their community. So as one of the clients said here, because they were joined in with Friendly Call and they were linked in with a friender, that gave them the confidence to link in with a local prayer group. And that's something that maybe wouldn't have happened had they not been linked in with Friendly Call and not had somebody to issue that encouragement. And then lastly then, when clients, when they were talking about how they appreciated the service during COVID, it was very much kind of framed as how consistent and reliable the service was in the context of other changes that were ongoing in their lives. So we know that a lot of changes are kind of happening in the background for Friendly Call, and I think it's a real kind of testament to the service that from the client perspective, it hadn't changed too much. They were kind of consciously aware of how much the service had worked to keep that consistency. And the fact that, they recognised while the service was under pressure, the calls remained the same and they still had the same link in with the service. So in conclusion then, from the point of view of implementing the service, that process involved being able to capitalise on existing connections that the Friendly Call service has with other agencies and organisations. It also presented an opportunity to build knowledge and to strengthen existing networks, and it also brought on changing roles or upscaling existing roles. It was a rewarding experience for volunteers, those who were joining the service during COVID, and it also provided a consistent connection for clients during the pandemic. So in terms of our next actions then, so as I said, we're hoping to hold a workshop next week, and our idea is to collaborate on potential actions for the service. So to really build on what works well about the service and to be able to think about what actions might address the challenges. And our ultimate aim, I suppose, by doing this research and this project, is hopefully to facilitate Friendly Call to develop as a service and to continue to provide connections and the invaluable support for older people after COVID. So I'd like to thank everybody who's taken part in the project so far. You've given an awful lot of time to it, and so that's all the coordinators, volunteers, clients and healthcare professionals. I really appreciate the time that you've given, and also I'd like to say thanks to our team who really keep the research going, and we're hoping that we can launch the report early next year, so we'll keep you posted on that. So thanks very much.
Thanks, Fiona, for that presentation that you mentioned, and we certainly look forward to your launching the report early next year. I think that'll be very, very interesting for us. Fiona, stay with us as well for the Q&A, so if anybody any questions in relation to Fiona's presentation. You can put them up on screen and we'll talk about them later on. Just to put things in perspective, Fiona, as well, last year at the height of the pandemic, I think we had nearly in excess of 400 clients. And if it wasn't for the strong volunteer base that we had, we would not have been able to look after all these people, you know, so it is very important from a volunteering point of view that we continue to get that support from people, particularly people around the north side, and to help us out, you know. Now, in relation to volunteerism, and I want to move on to the next item on the agenda, and we have Maura Long, who will be having a conversation with one of our staff members, Margot Hayes. Maura Long has been a volunteer with the Friendly Call Service since 2014. Maura is known as the mother of Friendly Call Cork. Maura, who is 76 years old, and it was when she retired at 70 that she joined the team at Friendly Call Cork and has been with them since. She has completed a number of courses with Cork City Partnership. She was in receipt of an Acorn digital tablet and completed remote drawing via Zoom during the first COVID lockdown. Last year, she was Cork Volunteer Centre winner of 2020 Volunteer of the Year. North City recognising her volunteering with Cork City Partnership and her fundraising headship for the Mercy Hospital and Friendly Call Cork. Through COVID, she was cocooning, but all the time volunteering as well. She's had her own health issues and had a very close bereavement in late 2020. Nevertheless, she's always there supporting her peers and supporting us to do what we do better. Good morning, Maura.
Good morning, Michael.
Morning. Good morning, Maura.
Morning, Margot.
Great. Listen, I'm delighted that you could join us here this morning. And I'm just kind of reflecting on the fact that the Minister earlier and all the other speakers really were talking about the importance of volunteers. So it's brilliant to be able to talk to you here as the mother of Friendly Call Cork, key volunteer, you know. So I suppose just, I know you're volunteering with Friendly Call Cork since 2014. So just maybe to kind of get us going this morning, could you maybe fill us in a little bit about what's involved, what you do when you volunteer with Friendly Call?
Well, what we do is we ring people that are vulnerable or live on their own. We ring them every day, throughout the whole year, even Christmas Day. We ring people and, you know, they are so delighted, some people to get, all of them, not some, but all of them to get a call. You know, and it's very rewarding for the volunteers. I find it very rewarding. And it gets you through. You know, you think you have trouble until you listen to some of them. And, you know, we help as much as we can with them, you know. Like one of my clients, I send him over a dinner every Sunday. And that started because he was saying he was going home for Christmas, but he didn't. So I just said, look, John, I'll send you over a dinner. And even my grandchildren now and my great-grandchildren on a Sunday, because they all come to my house for Sunday dinner, they all want to know, can we take John's dinner over? So, you know, and they know what I do. You know, they call it work, but I don't, you know, it's easier to explain to children that I'm going to work. Now, since COVID, you know, we have to stay at home, which is great, but you miss the banter in the office and things. You know, you'd be calling in or somebody is always calling in, and we miss that. That's
obviously you've had to go home, so like I'm conscious of, we'll say the word cocooning there that you mentioned earlier. So it's obviously a trend. That's a hated word across the board. But you know, when you had to stay at home and when you couldn't call into the Friendly Call office, and how did you manage? Did you just move the calls at home, or how did that work out?
Oh, we did the calls from home. That's what we did. And you know, I think everybody helped out, because at the start it was hard. That's what it was. You know, and we ring the same people every day. I'm sure they're sugar sick of listening to our voices at this stage. But no, they are very, very appreciative of it that during the pandemic that we did keep calling them every day. You know, and we had a lot. Some of the cases, you know, especially the mental health cases, like I used to have one now and he couldn't stay at home. I have to go out, Maura. He said, I have to go. And the guards stopped him several times, but they understood. He'd have to go out for his walk every, you know, into town and back out. And like he was so appreciative of, like, aren't you great to ring me every day? And, you know, it's great to hear that for us as well.
It obviously meant a lot to him to have that connection.
It did. And you know, like he'd say, Maura, can I go here today? Or they're saying this is open. A big thing for him was not being able to go to Mass. And I said, well, you know, you can get it on the radio, or you can, you know, on the television, because a lot of the times Mass was on the television. But it was like he won the lotto when the churches opened that he could go to the church. You know, and that's sad, like with people on their own.
Yeah, and I suppose, I know you mentioned that particular situation there now for that gentleman, which over the last 20 months, you know, you've been a comforting voice to people, you've been a listening ear. Well, are there other kind of needs? What were the other needs that struck you from people over the last 20 months or so? What were the kind of concerns and needs that people were telling you about?
Little jobs that they, you know, they had no one to call on to get jobs done, like doing their shopping now or doing, getting their prescriptions. Like a lot of people would say they're only small little things, but to them they were big issues. And you know, I mean, still people are afraid to go out. I have one woman now, and you know, I say to her, you know, you can walk up and down the road. And she said, oh no, my back garden will do me. It's still around. Now, she won't say the word COVID, but she just says, it's still around, Maura. And to me, that's, you know, God help us. She's afraid to go out outside her own front door. She looks out the window and she sees the people passing up and down and she thinks it's wonderful, but she will not go out.
That loneliness that she must be experiencing then too by just not being able to. And,
you know, and like I said to her, even if you stood at your gate, you kind of be saying hello to people passing up and down. But no, some of the older people are still very afraid of it.
Moving forward, when we think of what we need to be doing next, I suppose it's that fear that we need to be looking at.
Yes, we need to kind of alleviate that fear from them.
And you mentioned earlier, Maura, about, you know, the needs that you were hearing about was around getting people's prescriptions or, you know, shopping or food. So how did Friendly Call or other Cork City partnerships respond to those needs, other services respond to those needs? Did something happen? Did people do more?
They did. Like Cork City Partnership, they did shopping for people. They did deliver to their homes and things with a lot of care. And getting prescriptions. We had, I mean, Cork City Partnership were excellent in providing that kind of support. And anything we needed, we got. That's what
it was important because, as you say, they were things that mightn't seem that big a deal to a lot of people, but were very important on in the day-to-day life of so many.
Very, very important to a lot of people. And I think the rolling out of the tablets, the Acorn tablets, people, I mean, yesterday now there was a Zoom test, and it's great to see some of the people. Now, they don't understand them fully, but they think they're wonderful, that they can ring one another and things. And it's great to see their faces, you know, that they can see people and, oh God, Maura, we didn't see you for a long time, and which I wouldn't have seen them with no afternoon teas now or anything. You know, a lot of those are limited, but hopefully we'll get back to them soon.
You think they're making a difference at least, and the rollout of those has been important in keeping the connection for people?
Yes, keeping the connect. Like they wouldn't, a lot of them wouldn't kind of be connected otherwise, but I think when they can see the person they're talking to, it means an awful lot to them. And with the tablets, they can do that.
And they were people shown a little bit how to use them? Was there a bit of training around it?
There's training every week. That's what there is. DTL, they have Zoom classes every week. And they go through everything with them. If you have any queries, Kay goes through everything with them. And it's great to see their faces, you know, from when they started with them up to now, the difference that they can use the Zoom, and now some of them call it Boom and everything else, but the difference that it has made to their lives is great.
Well, that's part of what we're hearing this morning, is that obviously things have been very, very difficult for people, but people have done things that they thought they would never do as well. Well, you know, that kind of way. So yeah, you know,
and they're like a lot of them now. One man, Maura, when is there any classes starting up? So like Cork City Partnership have started back up with some of the classes and things, which is great for them because it gets them out. Will it be safe? And, you know, we tell them they wouldn't have them unless they're safe and things, you know, and it's great to see them, some of the people kind of starting to come back a bit. And as the minister said there, the day centres opening, I think will make a big difference to some of the people.
There's still services that aren't yet open that we need to be able to access. And you're talking about, I suppose, the tablets being huge there, but and the courses, external courses. But I know over the lockdown kind of situation and COVID, you were doing some courses yourself, because I'm aware that when I was chatting to you last, you were midway doing a level QQI level 3 drawing, and you had to shift to online learning. How did that go for you? Did you manage?
All right, it was different, but like my kids get a great kick out of it. They say you must be the oldest swinger in town with your. But I found it great. You know, I loved it because even online, you're still meeting the people and talking to them and things. And, you know, it's a different way of learning, isn't it?
Yeah, it is. And I suppose it's around the connection and around the learning. So you're half a pro now at it, Maura. You're on your online webinar this morning, and your QQI starts from your online learning. So it's a real credit to yourself, really, for being able to stick with it. And I suppose just COVID isn't gone away. We're kind of conscious of that.
Unfortunately not.
Unfortunately. And I know you mentioned around about the needs, that some people are full of fear, I suppose, and are unable to re-engage, and others are starting to kind of get back out there, starting to re-engage in their communities and in courses and in activities. Are there any other kind of lessons or anything else that strikes you, or what else over the last 20 months, anything else that you think, well, you know what, we should take that on board?
Well, I suppose, you know, visiting people and get more people involved with volunteering and with helping out, even if they can't. You know, some people now wouldn't be able to go on the phone and things. But like if we could find something else for a lot of them to do. Like I think the tablets now are going to help us an awful lot. Because when they get used to them, they will be more confident in themselves. You know, and I suppose there's a lot of things we could do. You know, I know my kids, I like 2 of them, they'd love to get involved more, but unfortunately they never know which day of the week they're off until the week before, which if you're trying to organise something, it's not good coming in the last minute and things. But no, they, as they said, they do enough with putting up with me.
But I suppose the point around maybe us looking at volunteers and volunteerism and being as flexible as we can to encourage more people to volunteer, because obviously volunteers like yourself, you're making such a huge impact. So the more people we can encourage in.
Well, this is the thing, like, hopefully we can encourage more people to volunteer, you know, which would be great.
The services that you're providing by listening to people and talking to people, the benefits are huge. As you've just said there, you've impacted on so many lives over the last couple of months.
But I mean, you get as much as they do out of it, really. You know, because the banter with people and things, and, you know, we have good chats. Now, some of them, some days they might only want to say hello or goodbye. And as one woman said to me, oh God, when I started, listen, for months, I know there's someone will ring me in the morning, that if anything happens to me, there's somebody going to ring, and I won't be there for days. And I think during the lockdown, that worried a lot of people. That, you know, people weren't around, people weren't calling to their doors and things, and that worried them. So, like, if you can reassure somebody, you get as much satisfaction out of it as they do.
Well, I think, Maura, what you've been doing is just fantastic, knowing that the difference you're making. And as you say, you're benefiting yourself. But I think really you're inspirational, really, and you're truly fantastic in what you do. So I suppose just really to thank you for your insights there and your thoughts, and you're so involved in the connecting in with people in your local community. And so a big thank you from us all, and it's been lovely chatting to you this morning. Thanks, Maura.
Thank you, Margot. Bye.
Thanks, Margot, and Maura, to thank Maura in particular, and all the volunteers that keep the show on the road up in Churchfield, a fantastic bunch of people, and they were very grateful for their support. I also want to mention that at this stage, even though I'll be introducing her shortly, Brenda Barry, captain of the team up there, doing a fantastic job over the years, absolutely brilliant woman, and they were very grateful to Brenda as well. So our next presentation now is by Jackie Sweeney and Brenda Barry, Cox City Partnership, who will be talking about CCP's services to older people through the pandemic, and in particular how we scaled up the friendly call service. Thank you.
Thank you, Mick. I'm here. I'm very lucky. I'm here today with the captain of the ship.
Yeah.
I'll be talking much more detail about the friendly call service. But just to start, we're going to look at Cork City Partnership's work with older people pre-pandemic. Just waiting for the slide to come through. Sorry, just waiting for the slides to come up. I'll make a start. So there, before COVID hit, we'd already started, as Mick said earlier, we've already started many years supporting older people. And some of the range of activities we have been doing over the last number of years are shown on this slide. So at the top, someone else has mentioned earlier, the provision of the application for senior alert alarms for older people. We've had a consistent demand for those applications through the years. So we'd be looking at almost 200 provision of elderly alarms through the year. Moving around the circle there, we've been supporting older people's groups for a long time as well. The picture there shows the Fairhill Men's Art Group. They are a group of older men who came together and through art continued to socialise and to improve their art, and have gone on to great achievements. We've also run a number of courses for older people specifically for the over 55s. And there on the screen, you can see the digital photography for over 55s that has been running for a good number of years now in the Knocknaheeny office. The top left is a very important one, and Mark mentioned it clearly in his presentation about social activities and the importance of social activities for the older person, for all of us, but particularly for older people. Pre-pandemic, we were holding monthly tea dances on a Sunday in Grana Braha, which had become very well attended and quite a fixture on the in the diary for older people. So lots has been spoken of this morning about the friendly call service. Friendly call is definitely one very strong element of the work that we've been doing. But throughout the last number of years, there's been several other activities that have been surrounding Friendly Call, but Friendly Call is very much in the centre of that, in the diagram there. It's at the core of the work that we do, and certainly through the pandemic, that's where we put our focus. I'm going to hand you now to Brenda, who's going to talk about the background to Friendly Call and give you some more of the detail.
Thanks, Jackie, and thanks everybody who's contributed so far. It's been great, and it's been very enlightening, and it's been, you know, stuff that obviously we agree with or whatever, you know, but no, very good. So just to give a quick background on how Friendly Call started, I suppose it was established by Cork City Partnership in 2010 to address issues of isolation and loneliness. There was a feeling there was a bit of a disconnect in you know, some communities, and that people weren't really checking up on their neighbours, or people weren't in touch. So it was initially set up as a pilot in the Browner area, and then it moved out from there. So because it was easy to do that, but it is just really about, I suppose, looking after people who are really alone and isolated. And, you know, sometimes a phone call is just so much easier for somebody to accept than somebody calling to their door, and they don't want anybody coming into their house. So look, it worked really well from the off, and the initial people that came on the service really enjoyed the calls, and you know, they didn't feel it was an intrusion, but more of a checkup, you know. So look, it's a free service, obviously, and it's 5 days a week. And, you know, we do it over Christmas. We do it at the beginning of COVID. We would have done it 7 days a week, you know, whatever people needed or whatever we felt, or if the volunteers felt somebody needed that extra call. And it is all about having a relaxed chat and checking in and see how somebody is feeling. You know, we have plenty of, I suppose, you know, older people will have a lot of contact with their doctor or with their nurse or whatever, and it's very medical, you know. So ours is about how you're feeling, you know, in yourself, or how's the form, or what are you doing today, and have you had your lunch, and you know, and what are you going to go out for a walk, or what are you going to do. And it's different, and it's nice to get a phone call like that that's not about an appointment, or it's not about, you know, what you need to do or a prescription or whatever. It's just, how are you doing, you know. So it's nice. And then there's also the backup, you know, if the call isn't answered, you know, our volunteers, they're just fantastic. They'll phone, you know, either the client's family, or they'll touch back to me, and we'll get it checked up. I mean, some people don't have family, and in that case, we'd ask the community guard, you know, to do a welfare check for somebody, and that has, you know, over time, like there was a couple of times where people had a fall, and maybe we got them to hospital before they otherwise would have, you know. So so look, pre-COVID, everything is pre-COVID now, but pre-COVID we were citywide. So as I said, initially just Growner, and then Northside, and then the whole city, really, because obviously it's not, you know, you're not moving around, we're making phone calls, and all our volunteers were coming up to our lovely office in Churchfield. We're just attached to the parochial hall there. And we were ringing about 200 clients every day, and you'd have different volunteers would come on different days. So the volunteers were doing a kind of a 1 day a week commitment, which was nice, you know, come up and we'd have a cup of tea too, and a bit of a chat, and you could have 5 volunteers on any given day coming up to the office. So things changed a lot, you know. And then obviously we had the befriending visits going, so we had different volunteers then that would be matched with clients, and we had about 50 visits going a week, you know. So somebody would visit somebody every week or every second week to check in, and might have a cup of tea, they might meet, you know. We had once one client and volunteer used to meet in the Metropole foyer for coffee every Thursday evening at 5 o'clock, and you know, it was just really nice. We used to have afternoon teas bi-monthly. We would bring our clients, try and get them there, you know, take that fear for people to, you know, that our clients would pick them up, or Anthony, or as you can see in the photo there, Anthony would pick people up and bring them to an event, and then he'd go off and do another run, and between us all we'd kind of get everybody where they needed to be. So whether we were in, you know, City Hall, the Lord Mayors over the years have been really generous in inviting us in for afternoon tea, or we went to Nanonagle, we've been to Collins Barracks, and we'd other companies that allowed us in as well. So people really look forward to that. But I think we should move on to COVID. So, and here's a little clip here from one of our clients just about the calls. It's a
the friendly call service that's operated by Coxley Partnership, the volunteer-driven service that signs up all the people in the area, contact them by phone, and that's great for people who live on their own to get a call and have a chat with somebody.
My husband was an invalid for 5 years and he died last October. And a friendly call called me every morning, and it was brilliant for me because I knew somebody was going to call, and if I was in trouble they were there to pick up the pieces and to help, and it was very reassuring for me. It's absolutely wonderful because I know when I go to bed at night, if I'm not right in the morning, somebody is going to ring, somebody is going to know whether I'm dead or alive.
That's lovely. That's Kathleen. She's one of our clients, and she's just lovely. And she's also now in the afternoons ringing a few clients as well. So she's kind of has a dual role. She receives her call in the morning, and she'll ring a few people in the afternoon, which, you know, keeps her busy, and she enjoys the chats. And she's you know, she's really delighted to support people as well herself, as well as receiving support. And look, if you can see from Kathleen, like obviously the calls do help to reduce isolation and loneliness, greater peace of mind for family and caregivers, certainly reduced level of depression, anxiety, that you know somebody's going to ring you, you know your phone's going to ring, you know, and we kind of keep it, you know, if it's a morning call, it's a morning call, and some people prefer the afternoon, so they ring in the afternoon. So it's pretty consistent time-wise as well, you know, give or take. But people, it's nice to know that your phone's going to ring and someone's going to check up on you, you know, and you have that confidence that it's going to happen. And you can talk about whatever you want to talk about. And sometimes, as Maura said, some of the calls will be really short, you know, if you're in grand today, thanks very much. And sometimes they're a lot longer. And look, we can help. Well, a lot of stuff we've been doing, you know, I can send messages now. We have WhatsApp groups and we've email mailing lists to volunteers, or texts people individually to our volunteers to let them know of stuff that's going on, or supports that might be there for clients or something if there's anything going on. And we would have been doing that all along, you know, and referring people to other agencies and groups where needed. So like when COVID did break out, like a lot of people wanted to go on Meals and Meals. A lot of people were used to going out for their dinner. They'd go out for their lunch of a day or whatever, and then to find, you know, there's nowhere open, there's nowhere to go. So like we would have sent a lot of referrals to Meals and Wheels, or we'd be working with the community work department with the HSE, you know, and particular people in particular cases that they might be concerned about, you know. So next slide. So and then I suppose when COVID hit, then we just had to step things up and do things slightly differently, but in the same way. And, you know, as Maura said, that, you know, we did everything that we did before, but we did a whole lot more as well. So, and I suppose it was really important when it happened first. Sure, nobody knew what was going on, a pandemic, and people were supposed to stay at home, and you couldn't walk more than 2 kilometers from your house, and every restaurant and pub was closed. It was just, you know, it was something really scary. And then people were worried about getting their shopping, and people whose children lived out of Cork City or whatever. We had calls from America and France and Australia. I'm regularly in touch with a girl in Australia about her father. The people just connecting in to find some supports, to find help for their loved ones at home, you know. So look, straight away we had to work on capacity, you know, and we had a volunteer recruitment drive, and we had help from agencies as well, from like the council and from the HSE, where they gave us over some staff, like with 5 librarians volunteering at one stage, and it's fantastic, you know, and they really enjoyed it too, and they enjoyed the chats, you know. And then we had to get all our volunteers to volunteer from home and to work remotely. So that meant that, you know, the likes of Maura, who'd love to come in for the chat and the crack, had to stay at home. And then we bought loads of mobile phones and credit, and, you know, we didn't want people to incur costs. Like some people use their own phones, and a lot of people use, you know, phones that we provide, so that there isn't a cost incurred on volunteers to get involved, you know. And then we had to recruit more volunteers, which we did. And, you know, in fairness, you know, people really step up when you know, it's needed. And like some people like Fiona, for instance, who's our researcher, is volunteering since March 2020, and she's still at it, and she's doing her other work. And you know, some people might do 1 call a day or 2 calls a day, but some people might do, you know, like 10 or 15 calls a day, you know, and bring the same people every day and build up that relationship. So look, it's been invaluable to people and to our clients, but also to our volunteers, and you know, you get their gratitude straight away. You know, people say thanks every day, you know, and we get loads of mass bouquets and we get loads of thank you cards, and you know, it's nice to know, you know, and it's a real motivator for volunteers too. It's really nice to know that you know, it's appreciated, and it is so simple. It's just a phone call, but it's so reliable, you know. Our minibus as well, just to say, has been invaluable, especially, you know, people weren't too keen on public transport. I know a lot of hospital appointments initially were cancelled, but public transport wasn't really an option for a lot of people. And it wasn't for a lot of people beforehand anyway. Like, we had the bus from 2019, and what Anthony, our bus driver, was doing to bringing people to hospital appointments and bringing them in the door of the hospital and sitting them down in the right place, and just, you know, coming back in from when they were finished. So either the client could ring or the hospital would ring him and tell him to call back or whatever. And that's bringing people from door to door. So with COVID, then we got a screen actually to divide the passengers from the driver, and it was sponsored generously by King Print in Douglas. But it just created a better, more safety for people, obviously, you know, and confidence that, you know, if they got on the bus, they weren't going to get COVID off the bus. And they're probably most likely, you know, it's just an 8-seater bus. They were most likely the only passenger in the bus. And that's what we've been doing since. And a lot of people, you know, needed to visit family in nursing homes. So if their partner or their husband or wife was in a nursing home, like, you know, it's just to get them to that, because often nursing homes aren't on bus routes, to be fair. And then getting people to hospital appointments, really important. And then when the vaccination started, getting people to vaccination appointments, any appointment they needed. And then Anthony has also been helping with the Meals and Meals in, he did it some work with Knocknaheeny, with Gronabraher and Farranree. He's still delivering for Gronabraher and Farranree. Again, that's invaluable, you know, because a lot of Meals and Meals volunteers, obviously, you know, also had to cocoon, because that's kind of the demographic of people who volunteer for Meals and Meals, you know. So look, I suppose our key issue and what we wanted to do was to reach the most isolated older people all around the city, and also to know that we could, you know, that if we started telling people that we could do it, that we could actually do it, you know. So we had to upscale our capacity like hugely, and you know, I suppose some of it was, you know, we were working what came we up against, you know, but we definitely like increased volunteers, and there are some, I have to apologize, volunteers, people who tried to apply, but it was just so hectic, you know, that it was very difficult to get back to everybody. And then we had to move the training to Zoom, and you know, and some people didn't know how to, well, I didn't know how to use Zoom, nobody knew how to use Zoom, so we were all learning. But you know, we really did learn really fast, and you know, as Maura said, we continued to provide the service after as we did before, except we did more, you know. And for reaching people, I suppose, look, you know, initially it was a national thing, but then when the COVID community response teams were set up through the councils, I think that made a good difference, because people could ring a number locally if they had issues, you know. We had loads of social media stuff posts, you know, which people would see. And even, as I said, internationally, like I got phone calls from people referring their parents or somebody who was at home, you know, so they would just Google and find us, you know. And obviously the local media were very good, like the radio stations and the local papers, you know, letting people know that we were there and if they needed help. As I said, the Cork City Council Community Response Helpline and the newsletter, we appeared in that every week. And the HSE then, like public health nurses, huge amount of referrals coming there. Also from Alone, based in Dublin, but you know, people would ring the Alone number and they would refer them back down to us in Cork. And then discharge coordinators in hospitals, anybody really connected with working with older people, you know, we were getting referrals. The community guard were doing an awful lot of, and they had done an awful lot of welfare checks for us throughout, and they called to a lot of houses, and then would refer people on that, you know, they felt could do with it, you know, a daily contact. So, and Cork Volunteer Centre were the stars of the show, because obviously, you know, the volunteers kept coming in while we had stuff on our own social media and in the bulletin and everywhere. A lot of our volunteers came from Cork Volunteer Centre, which has been great to, and still do. So, so look, in the beginning, obviously, you know, when the government said stay inside, don't go outside your door, I mean, it's fearful stuff, really. You know, it's like, you know, what am I supposed to do? And, you know, a lot of older people, a lot of older isolated people would have been really independent, you know, would have been doing their own shopping, and they wouldn't want to be asking anybody for help. So it was a big move for them. And then even to get in touch, like a lot of our people, of course, were already vulnerable and alone, and we're doing the call. But newer people that came on the service, you know, I mean, only for COVID we might know about them. And to be honest, you know, in a positive light, I suppose maybe COVID created room for us to find people who really needed help. But we did a lot with practical supports, and that was through, you know, Cork City Partnership, getting the SciCap team, and actually anybody who was employed in the partnership got pulled into some part of either delivering hampers or jigsaws or, you know, birthday cakes, walking dogs, you know. The two STEM team did an awful lot of maintenance. I know Tom called to a house one day, and it was like he had to replace 3 bulbs, you know, just light bulbs. The lady just couldn't do it. She was on dialysis. She didn't know anybody that could do that for her, you know. And, you know, you don't want to get an electrician to change bulbs, really, you know. We just, simple jobs, but they make such a big difference, you know. So we were doing that. We were doing grocery shopping for people, you know, and at the same time, we're not taking over. We were encouraging people, you know. The super values in the centres were fantastic, you know, because you could ring, whereas maybe Tesco's, you'd have to be able to do online shopping, which, you know, we'll get to with the tablets. But it does, you know, it just gave people that time to get sorted. And like, we didn't want to ever become grocery shoppers, to be honest, you know. So it was nice to be able to say, look, can you ring your super value or whatever? And to enable them to take control of the situation. So we were there for the beginning, and even delivering food hampers. I mean, we acknowledged there was never a problem that people were short of food, but it was just the getting of the basics into your house for the week, you know. So, you know, at least they were there. So it was, you know, and it was through Feed Cork, and the hampers were really good because it was just stuff, it was aimed, the hampers were aimed for people who lived on their own. So they weren't going to be having bags of pasta or rice, you know. It was going to be like fresh stuff like yogurts and ham and cheese, bread and milk. So look, the basics, and that saved people from having to go to the shop for the small things. And then we could work out the big things. And as I said, a lot of people, we refer them on for Meals and Wheels or whatever. And then the other supports, I suppose, we looked at, you know, people wanted books, the libraries were closed, and some people were really perturbed about that, you know, and they were struggling. So we had a book collection among our volunteers and among the staff of the partnership as well. And that worked out really well. And we're still delivering a few books here and there, but we've also linking people in with the library, who are fantastic. Like I had a couple of people that, you know, got the library to deliver them the housebound service, which was fantastic. And I was able to refer on there. We were also sending people birthday cards and Christmas cards. Birthday cards, we would have had their date of birth when they first become a client on the application form, and Christmas cards. And we got volunteers from all over the city and everywhere. I got cards from Tokyo. People made cards and posted them to us, and we posted them out to the clients. So they're all homemade cards. Beautiful idea. And, you know, we had other companies that did letters of hope for people, just a bit of encouragement, not a birthday, not Christmas, just a card in the post to say, you know, stay strong and this will pass or whatever. And that made an awful difference, because you know yourself, it isn't often you get cards in the post now. It's mostly bills or, you know, other stuff, but it's nice to get something personal like a card. And to be honest, you know, one of our clients said he had framed his birthday card. He was so delighted with it. So, and they'd send a card back, you know, which is nice for people to have someone to write to. They might send a thank you card back after receiving the card. So, yeah, oh, sorry.
Okay.
Yeah, thanks.
As Brenda was just saying there, obviously there was huge additional demand placed on the Friendly Call service and all the additional supports that were put to that at the start of the first lockdown. And it really did mean that internally in the partnership as well, we had to re-gear other programs to support the Friendly Call service. So just some of the ways that we did that through SciCap, which is our core program in terms of social inclusion and community activation in the company. It took over the overall management of the service. At some points, there were 5 SciCap staff members full-time employed and redeployed onto supporting Friendly Call. And the types of activities they were doing, they were also making some of the phone calls to supplement the volunteers. They were out doing the grocery shopping, the hamper delivery. They were making contact with the local authority in terms of housing issues. They were also liaising with the volunteers and maintaining the database of information we have on that. Very early on, we set up 2 task groups within the partnership. And again, SciCap staff were at the fore of that. One was very much to look at the call service and the volunteers that Brenda's been talking about. And the other one, we realised we needed to split the team really so we could really maximise our effort. And the second team looked at getting food, collecting it and distributing it out to the older people in most need. Through SciCap 2, we funded some of the groceries and the bulk purchase of food for the hampers, and also the additional costs involved in the mobile phones and the volunteers working remotely. Some of that was covered through SciCap 2. It provided all the backup admin support. And really the key, I think, that we want to say is that the flexibility of the SciCap programme really did enable us to scale up the service, and we're very grateful to the RCD for allowing us to do that, and the local LCDC too. Aside from SciCap, again, as Brenda says, really all the programs within the partnership did support Friendly Call, but we just wanted to bring out SciCap today and also the TOOS program. And certainly here, like the TOOS team leaders and the coordinator are fantastic in giving backup. They have a number of vans available, and they were very much involved in the delivery of the food, the hampers, the comfort packs that we got through the Irish Red Cross, and also doing basic maintenance and repairs. And you see there on the screen the repair to one of the client's fences that got burnt down during the lockdown. So they were able very much to be out and about, and we're really grateful for the work that the team through SciCap and TOOS did to support Friendly Call in particular. But again, it wasn't just about Cork City Partnership and the staff involved in our own programmes. We got huge support right from the off from other agencies and groups. And in particular, we just want to mention the HSC Cork and Kerry and Cork City Council and the LCDC, because very early on they enabled staff to be redeployed to back up and do the phone calls for us. And they also provided additional funding. And Brenda just mentioned there that the 5 librarians in particular were redeployed through the Cork City Council, and they gave great support and backup to us. Other groups too provided their own staff, so the likes of Arup and the Churchill Community Trust, again they enabled their own staff to volunteer with us and do some of the phone calls for us. And I suppose another critical element was the costs of providing the service increase. The numbers were larger, the volunteers working remotely, some of which we needed to provide a mobile phone for. So we were very grateful to get additional resources to reduce our own costs for phone credit, for masks for clients to give out to clients, the comfort packs, the food, and also the additional costs of running the crucial minibus. So just to summarise really the impact of Friendly Call through the period, in 2020, over 430 people were receiving supports. Brenda said before the pandemic, we'd put our maximum really around 200 clients. So through 2020, we over doubled what we thought was our capacity pre-pandemic. Most of the clients were over 70, but we also saw a big increase in those that were over 50. At the peak in the summer of 2020, over 70 older people were receiving food hampers every week through us. And again, Brenda's already mentioned this, but a key element really is the access and referrals to other supports, such as the senior alerts, such as the courses, the Acorn tablets. They're all internal services through Cork City Partnership. But again, outward referrals onwards to Meals on Wheels, the local authority, etc. And again, and Moira brought this point out very strongly, it enabled volunteers to keep going and contributing in supporting others through the pandemic. So they're very much what we see to be the impact of Friendly Call through that period. But that's not to say we didn't keep going with some of the other activities as well. We were still able to keep going with the groups supporting older people. Some of the courses moved online through, which I'm now going to call Boom forever myself rather than Zoom. The senior alerts, again, a consistent demand through 2020 and into this year for senior alert alarms. That doesn't decrease at all. But the one that's missing and has been very much missing, and again, Mark was alluding to it this morning in terms of the importance of social activities for well-being. And that's the one that we haven't been able to restart as yet, but it's something that's in our mind. We know we want to start it. When there's a demand and it's safe to do so, we will be reintroducing the social activities into our range of services. So just the final two slides now. In terms of the key reflections from us, from Cork City Partnership, and in particular the scaling up of Friendly Call, we know that we've had to rethink service delivery. We did it very quickly, and it has changed how we provide supports to older people. We also know that if things worsen again, we know we can really quickly replicate the services that we put in place, some of which are still working, but certainly we need to scale up again, we can do so. The importance in delivering a service of flexible cross-programme supports and also the support of other agencies to meet the needs. And again, there was great goodwill for Friendly Call and the older people through the pandemic from other agencies, as well as our own internal staff. Key to us at this point is that demand is still very high for services, in particular Friendly Call and the senior alerts. We still have over 360 clients on Friendly Call receiving a daily phone call, so that's 1,800 phone calls a week. We did think that there may be a drop-off in terms of Friendly Call as people were able to get out and about a bit more, but really that hasn't proven to be the case. The volunteers, they're still working remotely and they've been doing a fantastic job, you know, as Brenda said, day in, day out, ringing people, since March 2020 from home. I mean, we can't thank them enough. But again, it's how to support those volunteers over the longer term and make sure that they feel connected to the service and want to continue, because we are reliant on the volunteers to make the phone calls. And so I suppose that really just the point there is, can we sustain this level of support into the future?
Yeah, so and just on the Friendly Call side, the practical issues, you know, it's just sometimes, you know, even the amount of participants that the TUS team had declined because of COVID, you know, and people did things that, in fairness, they probably thought they'd never do. They were changing people's locks, changing bulbs, they were fixing fences, fixing windows, doors, you know, like simple thing like a woman couldn't close the bathroom window, and it was just, there was such a draft, and you know, to get that done, it was like a godsend to her, you know. So and look, at the other thing we think of the ongoing client needs, you know, what are they now and how we can meet them. But you know, it's still, people are still worried and still afraid, and I think the past 2 weeks maybe would say, you know, COVID hasn't gone away, and I guess we thought when we got the vaccines that we'd be fine, everything would go back to normal, but it hasn't, you know. And I think that people are finding it extremely wearing, especially, I suppose, people who are older who feel, you know, their life is passing them by and they're not, you know, they're not really doing what they used to be doing. They're not going to their groups, you know, they're going to day centres maybe for 1 day instead of 2 because the numbers are restricted, or, you know, it's not as free. We're wearing masks, you know, you're not going to go out for your lunch like just at the drop of a hat. You're going to plan and you have to pre-book everything. So look, everything has changed. And if we have to go again, you know, with the more, I suppose, practical side of it, that's what we'll have to do. But look, talking to people every day, you know, helps us understand the volunteers, understand people's individual needs, and you know, everybody's different, and some people quite, you know, independent or whatever. But, you know, as Mark said earlier, like some people might never get back to the way they were. And as it is, like I feel my life isn't back to the way it was pre-COVID, and I'm sure most people, you know, are still the same. And then we connected with clients who we probably wouldn't have found aside from COVID, but who really their lives didn't change that much because they weren't really interacting with too many people either, but now that they're interacting with us. So I think that was a real positive as well, that, you know, we probably came across two people who would never, you know, we would have never found only for, you know, the I suppose the intense publicity about, you know, that this service was available. And look, to be honest, I feel great that we've found those people, and they really do need support, and they love the chat, and they wait for the phone to ring every day. And if there is extra stuff, you know, we know a lot more, as Fiona said, you know, that some of us thought that, you know, throughout COVID, that we learned a lot more about what other agencies were doing too. So we're better able to link in and better able to point people in the right direction. And even stuff like, you know, some people in the under 65 category, you know, even trying to register for the vaccine, you know, we had people calling up to the office on days to help them to register. And like, there are barriers there with, you know, digital technology, and we've certainly done a lot to do to help with, you know, although limited, with providing Acorn digital tablets to some of our clients. But to be honest, there is so much, like even this local property tax this week, you know, that people have to value their house and do it online. There is no other way to do it. There's nobody to ring, as far as I can see. So we've done a few of them over the last few weeks for people, you know, that just want to get it off, because they worry about it, and they worry that somebody's going to come knocking on their door, and, you know, they'll be in trouble if they don't do it. So those are things that are going to be ongoing. But I do think the digital thing, it's really pushed people forward a bit. You know, the people that want, obviously some people will never want to learn about smartphones or tablets, but it has been great to be able to provide that to people without incurring those costs or the fear of it, you know, to get over the fear, because the support is there. And then I suppose it's about getting people back out again. And we have a few clients that are taking part in the PsyCap courses, you know, that the partnership are running. And it's just about, you know, having, you know, plenty of space, social distancing. That's going to be with us for a long time yet, I feel, you know. And then finally, are we reaching the most in need? You know, I don't know. I feel we did reach a lot more that need us than, you know, and as I said, look, we're not the last line of defense, and we never claim to be, but we're, you know, it's nice to get a phone call, and it's nice for someone to check up on you every day, you know, especially if that's the only time that your phone rings, or, you know, if there isn't anybody else connected in with you. And you see from Kathleen and John how important those were. So yeah, that's kind of where we're at, I think.
Thank you.
Thanks, Brendan. Thanks, Jackie, for the very comprehensive presentation. I think it was fantastic insights into our journey over the last 18 months in particular with Friendly Call. And I suppose the fact that it's not just about making that call, which is very important, but all the other associated services that are attributed to it as well. And as you mentioned yourself, the support we got from all the other agencies, particularly Cork City Council and the HSC, and of course our volunteers, has been absolutely fantastic. So well done to all. So we'll move on to our next segment, which is the panel discussion, the question and answers. And chairing that will be Brenda Carl, CEO of Cork City Partnership. And the panel today will consist of Brenda Barry, Mark Ward, Fiona Reardon, and Maura Long. I'll hand you off to Brenda now to take over from here.
Good afternoon, everybody. Here at the moment, so we'll get to that. I suppose really just to say, in one sense, that a huge thank you to Brenda here and to Jackie. The amount of work, even though they've talked for a little bit in the last 15 or 20 minutes, the amount of work that has gone into this program to upscale it has been absolutely phenomenal. And I think it's a kind of work that you can't do unless you have a passion for it. And I suppose really in a sense, Brenda, embodies the whole Friendly Call. Any service needed for an older person, she never operates within the lines. She always looks at what are the needs of the clients, what can we do Is it a cake? Is it a birthday card? Is it a lift somewhere? So really, in order to run a service like this, you have to keep your mind open in terms of don't kind of stay between the lines. Look at the needs of the client, whatever the needs of the clients are. And I suppose because Friendly Call always operated like that, when COVID hit, immediately it was always about the needs of the clients. What can we do? How can we respond? What's the need now they didn't need last week? What will they need next week they don't need now? And I suppose as well as that, as Jackie said, SciCap really stepped up as well. I mean, Friendly Call, I suppose one of the biggest challenges we've found, and something that's always really amazed me, is that Friendly Call is probably one of the most productive and positive programs that we operate and that we run. Funding has always been a difficulty. So I suppose I'm kind of throwing that out there today in terms of any agencies involved. I suppose we have struggled over the number of years to secure funding for Friendly Call, and as Brenda knows, we're always back and forward, and Brenda's sending off applications and Jackie's sending off applications. So for it to work properly, I suppose there's also background pressure of always trying to find the resources to run the service. And while during COVID, I mean, it was remarkable and so positive the way agencies and colleagues and other organisations stepped up. When COVID eventually quietens down, which please God it will soon before we all go mad, we'll be back out on the trail again looking for funding. So I suppose it's really about looking how that can be addressed going forward. But again, just to really acknowledge the work that Brenda and Jackie have put in. I mean, you couldn't write about it really. So well done, Brenda. And she's a great reporter with the radio. If you want to get on local radio in Cork City, Brenda's the woman. So we have a few questions. I'm conscious we've gone a little bit over time. So we have some questions here today. So I'll run through them quickly. So as Mick said on the panel, we have Mark, Fiona and Maura, and we have Brenda as well. So one of the first questions we have here is coming from Chris Dorgan from Cork Age Friendly Programme. And he says, the reporting of stress in older people is markedly higher amongst women than men. How much of this does Dr. Ward attribute to reluctance in men to report as opposed to men coping differently with stress? So I'll address that to Mark.
Thank you. Short answer is I'm not sure. It's very difficult to get a sense of the amount of underreporting from men, but our early kind of work in this, our suspicion is more that the burden of caring. So women obviously kind of took on a lot more caring roles during COVID, and we think that is associated with some of the increase. And also what we found is that a conflict within homes seemed to have a greater impact on women than on men, and particularly in situations where you might have multiple generations living within the home or a crowded housing situation and so on. So short answer, not sure how much of it is about underreporting. I suspect there might be some of that, but the bulk of it can be explained by other reasons, such as conflict in the households.
Okay, I have another question for Mark. So how did the response from participants compare or contrast between rural and urban settings, particularly in feelings in terms of isolation and also in terms of engagement with technology?
Yeah, so I suppose we find and have found over years that levels of loneliness don't really differ between urban and rural. And I think we always kind of assume that it's higher among rural participants. But in understanding why that might be, I think we have to make the distinction between social isolation and loneliness. So isolation is literally, a count of your social contacts. So it's objective in that sense. So that would be higher somewhat in rural areas. But loneliness, on the other hand, is people's subjective assessment of the quality and quantity of their relationships. And we don't find any difference between rural and urban. And if you think for a second, there's probably people on here, like myself or others, who, you can be very lonely surrounded by lots of people. And the opposite of that is true as well. Some people don't need lots of people around to not feel lonely. And what we found in previous work as well is that the types of social networks or relationships that people depend on does vary between rural and urban. So the types of things that are important for people's sense of not being lonely in rural areas is more tied into family connections and church and so on. Whereas urban participants tend to kind of replace those with more kind of informal interactions. So the two kind of counterbalance themselves. So again, short answer, there isn't a huge difference between the two. People have different kind of coping mechanisms.
Thank
sorry,
you.
the IT was the second part of that,
Yes,
wasn't it? Yeah, so obviously like a big problem is access to IT. You know, with broadband, sketchy at best in a lot of areas. I was delighted to hear about Maura's and people that she knows, their positive experience with using technology. It is great. It's more and more a necessity in our lives, but the reality of it is that online interactions don't replace face-to-face interactions in terms of what people get from them. You know, I'm sure to do a head count of the people on here today, the vast majority would much prefer if events like this could be face-to-face as well, and that carries on, you know, to all types of interaction. So I think technology has its place. It's becoming more and more essential. It has been really important during COVID, but you know, the sooner we can get back to real face-to-face interactions, I think the better. And on the rural-urban split, like hopefully this will give some greater emphasis to actually making sure the infrastructure is there so that people can access technology regardless of where they live.
Thank you. Now we have some questions for Maura. You're not off the hook yet. I suppose two questions really. What advice, Maura, were you given in terms of making the phone calls and I suppose handling the issues that come up, and what kind of support to put in place for you? And what advice would you give new volunteers coming in?
Well, Brenda was always at the other end of the line. If we needed, you know, questions that we couldn't answer the clients, Brenda would sort them out somehow. How she did, sometimes I don't know. And then new clients coming in, or new volunteers, sorry, I think it's so rewarding. And like, even if there's only 1 or 2 calls a day, then they get used to it and they want more and more calls, to do more and more calls, because you build up a rapport with the people you're ringing. You know, like my first call now today, and he'll kill me when I ring him, like I'm late, I'm at my lunch. So what are you ringing me for now? And then it goes on for about 20 minutes and things, and you know, that, like, you get great satisfaction, and we have a great kind of rapport with all our clients, really, when you get to know them. That's the truth.
And Fiona, you kind of started out with us really in terms of being a volunteer yourself. What was that like for you?
Yeah, I definitely kind of was glad to see people saying that volunteering was rewarding, because that's kind of definitely my experience. I think even as volunteers and other focus groups, you know, we're kind of isolated. We just didn't realize that until we started calling people ourselves. And it, you know, when you're working at home, you know, I think just even being able to link in with clients, it really kind of give you a different perspective on other people's lives and what was happening for them during the pandemic. And I kind of found that really interesting. So I would definitely kind of agree with kind of the sense that it was a really rewarding experience for me, just being able to link in with other people. So it kind of goes 2 ways, like Maura was saying, you know, you get something out of it, and I think the clients get something out of it as well. So,
Brenda, perhaps you could expand in terms of the type of training volunteers do when they come to you.
Yeah.
And what's the process?
Yeah, so I suppose we have an application form. So normally people would ring or email or whatever, and I'd send out, or they contact the Cork Volunteer Centre is great, and they always send on the referrals. So just to complete the application form, and again, it's, I suppose, look, it's open to, you know, I wouldn't really have volunteers under 20, really. Most of the people would be, you know, older than that, because it's just, you know, I suppose the chats have to be, the quality of the chat needs to be important, you know, and that's really the most important thing, to be able to talk to people, you know, and to put them at ease or whatever. We also just, all our volunteers would be Garda vetted, and we do that again through Cork Volunteer Centre. So that's the kind of an important part. And once that's done, then we have our training. Obviously it used to be face-to-face, but now I would do it via Zoom, so either groups or individually. And it's just, I suppose it's kind of the do's and the don'ts, and a lot about boundaries as well. You know, you don't want the client to end up outside your door, you know, stalking you, or, you know, on the other side, the client doesn't really want you turning up at their door. You know, there has to be boundaries, and of course people have arranged to meet up and have, you know, we had one of our volunteers last year, a new volunteer, and she went around to the 3 people that she was ringing who were not geographically, one was in Ballincollig, one was in Middleton, and somebody else was somewhere else not near, and she delivered Christmas baking to the 3 clients, and they were so delighted, you know. One of them just mentioned it to me again the other day, you know, just nice stuff like that. So look, the training will cover that, and the do's and the don'ts, and about what we're trying to do, you know, what are the benefits, what are we trying, what is Friendly Call trying to do, you know. And I would say to people, like, as I said earlier, we are not the last line of defense, but look, we can help find that last line if people need it, you know. And we would often have people with mental health issues or whatever, and we'd refer either to Shine a Light, you know, offer the free counselling through Cush Kim, or, you know, the Samaritans, and the Samaritans would refer a lot to us as well. So look, there's a lot of stuff in the training about, you know, I suppose, issues that people have. And if it's practical stuff, like obviously the practical stuff can be easier, can't it, you know. If somebody needs their grass cut, or, you know, we can get the tooth steam out or whatever. But so it's just to know what to do. And look, I always say to any volunteer starting, you know, if you have any issues, just ring me, text me, email me, you know, or if I'm not there, somebody else will have my phone. Don't worry, there's always somebody there at the end of the line. So there's plenty of support. And like, as Maura said, it's just, and Fiona, it's just so rewarding. Like, you know, every day, I love this job. Every day I go home and I say, yeah, well, that's okay, we're doing all right. And you can get drawn down by people, and you can get, you know, you'd want to bring them home. Like I want to bring everybody home for Christmas, you know, you can't do that. But, you know, it's just, it's very rewarding. So
yeah. We've had quite a few questions here now around, I suppose, technology. And this is for the panelists and Brenda. Would you all see, I suppose, technology as being a factor of how we engage with older people going forward, or are we all running, trying to get back to the face-to-face contact? Or, you know, I suppose maybe start with Mark on that.
I think it does have a role, but it's hard to kind of say a blanket, let's go all online, let's not. I think, like, we have seen the benefit of a mix. Like, for practical reasons, sometimes technology might be the only way to maintain contact with someone. So it's great that tool is there for us. But again, I think, you know, you really can't beat face-to-face contact. So I'm glad to see Maura nodding along at that, because she's probably better placed than me to answer that, from actually having been, you know, doing her work through technologies.
You would agree with that? It's more, I think, and we found this in the partnership, you know, we've had so many phone calls over the past month, even just maybe starting before the numbers started to go up, of saying, please, can we come back into meetings? Please, can we meet face to face? And we've organised, you know, Friendly Call, but other, you know, where groups can come together in an outside area. So I think it's hugely important. And sometimes the difficulty is, we've all, as agencies across the country, spent so much money on technology now. It's almost like we better use it. So I think it's a little bit about maybe getting the balance right, and maybe perhaps responding to the client. I don't know, Brenda, if you agree there.
I just think, you know, absolutely, there's nothing like face-to-face. But look, COVID has given us this opportunity. I don't know where that funding have come, you know, from Cork ETB, you know, it's the mitigating against educational disadvantage. And it just created a great opportunity, because not only were you getting a tablet, but the broadband was included. So people didn't have to get a phone line. You know, there was a SIM card in the tablets that we gave people. So look, it gave them a chance to get a start. And look, as you said, you know, some people just love it for RIP. Some people love it for the newspaper. You know, they can just have a scan to the newspaper. And I have one man, and he's into country music. So he's just on YouTube all the time, Googling American country music. And he's so delighted, because that was inaccessible for him up to now. So I think it can be something that we can work on. It's not going to be the most important thing, but I think to enable people like say John, who's going to be spending a lot of time at home now, to do stuff on a tablet and to enable them, but certainly not to replace the face-to-face, you know.
Yeah, and I think, I mean, I naturally said the first thing my mother does in the morning is open up the iPad to look out RIP Carrie and to get God. And every so often I get a shout going, where did that YouTube go to? You know, so I think, so it has opened up doors as well. A lot of us, you know, there's a fear around technology, and as you know, other services like online banking, everything's online now. So I think for a lot of people, including older people, it has broken down that fear barrier. Now maybe they still prefer to go into the bank, but if they have to go online, it's no longer this big, you know, terrifying experience. I'm very conscious of time. I'm very conscious of the huge contribution all our speakers have made today and giving their time to us and to Brenda. So I'm going to hand back now to our chairperson, who will introduce our final speaker, and just to say thank all the panelists and Brenda for your contribution.
Thanks very much, Brenda, to you and the panel, and to all those who submitted questions as well. So we'll move on now to our final speaker, which is Adrian Rogers, Chief Officer of Cork City Council and Cork City LCDC, to close the event. Thanks, Adrian.
Thanks, Chair. And I wouldn't say I'm a speaker exactly, but Brenda asked me to do a wrap up. So I suppose I'll just try and summarise maybe some key points, I suppose, that I took out of this morning. So look, firstly, well done to Cork City Partnership. I think today was really worthwhile, and I think it's very important that we actually stop and consider where we've been, where we are now, and maybe how that will inform where we want to go into the future. I think it was great to hear Minister Butler's commitment to the older groups and the supports. And of course, it was always going to be a pleasure to have our Lord Mayor showing his support also for initiatives like this. So I suppose just a few key points for me today. I suppose, Mark, I think you presented some really interesting and thought-provoking statistics and data. I think that 2/3 over 50 are socially active. That's a lot. That's a very high percentage, I think. Probably something that we really need to kind of celebrate as well. You know, I think it's a real positive. You mentioned the contribution to childcare. As a mother myself, I only know too well how much grandparents can contribute to childcare in this country. Again, something that I know we talk about, but I'm not sure we celebrate it as such. And maybe we need to do things like that, that it's not just kind of banging on about it, it's about celebrating it and I suppose just putting it up in the headlights there. And then there was the stat around 200,000 volunteers a year. Like, who knew? I mean, I certainly was blown away by that figure. So I think that was really fantastic. I suppose just in general in your presentation, things I suppose that occurred to me, Mark, as you were speaking, were I suppose COVID was a very sharp corrective action that we had to put in place. And we learned to live differently. And I think reopening will be slower. Reopening is like going up that hill, you know, and we just have to take it step by step, but we have to help each other to get there. And I think we need to be respectful and mindful of the concerns that people have. We shouldn't be trying to rush people into doing things that they're not comfortable with. And I think we need to take small steps, and it's one step at a time. I suppose other things that I really think would be useful from today is that it's given us, I suppose, that time, the space to contemplate and consider. And I think we should use this opportunity now to inform what we're going to do going forward. And I think it's important that there were positives, I think, as Brenda had alluded to earlier, that we would like to hold on to. And we really do need to consider what it is that we want to keep. But it's just as important for us to know what we don't want to keep. And I think we need to be sure about that too. So Fiona, just moving on, I think your statement on loneliness is a public health issue. I hadn't actually heard that before. Perhaps that's because I'm not in the space of public health, but I think that's a very strong statement. And I think it augurs well for us to ensure that we can actually put a spotlight on loneliness and how we should address it, because it is obviously linked with mental health issues. And we all know that mental health is a huge thing for people right now. You also mentioned long-standing relationships, and they're really important. And I suppose my thoughts around that were, there were 3 words actually that I felt were probably summarizing everything that was being said this morning. And that was agility, demonstrated by everybody, it was the collaboration that we all used through this difficult period in time, and it was the volunteerism. And those three words, they kept coming back to me when I listened to everybody speaking. So I also thought, Fiona, you had that statement on the volunteerism, a quote, that it makes a difference in your own life. I thought, what a wonderful tagline for volunteerism. So we should probably try and hold on to that. So Maura Long, I mean, look, all I can say is what a hero you are. You've given your family, your children and your grandchildren and great-grandchildren a great gift by your actions. And I just, if I could have applauded you today, I would have, but I couldn't do it virtually. But I'm telling you that you have my respect, and really, I thought your story was fantastic. And thank you just doesn't express how grateful and fortunate we all are to have volunteers such as you. And your story is true inspiration. You talked about the Zoom and the challenges around it. Don't worry about it, Maura. We're all good at bluffing, because I got locked out myself this morning when I came on. But you have to do that old swan thing, you know, like keep making it look like it's easy while we're kicking away under the water. So look, thank you so much, Maura. I really enjoyed your story. Brenda and Jackie, well, what can I say? Only well done on Friendly Call. I suppose I was just thinking Friendly Call was born, I'm not sure, was it about 10 years ago? And you can correct me on that, but isn't it fantastic that we actually had something put in place well in advance of the pandemic coming on top of us, because it was there and ready to be escalated. So just well done on that to everybody in Cork City Partnership. I suppose when I was listening to Brenda and Jackie speaking, and Brenda particularly when you were saying, you know, the calls aren't about the GP or, you know, the health piece, it's about kind of reaching out to people. And I was mindful of that ad that's on the TV where the son rings the father and says, "How are you, Dad?" And he said, "Sure, I'm grand." And then he said, "No, Dad, how are you really?" And then the conversation starts. So I thought that was wonderful, Brenda. And I think your passion and I suppose you're living and breathing what's going on there in Friendly Call, and I think that came across. So well done. You mentioned a couple of times that maybe you're not the last line of defence, but you're certainly the first line of defence, and you're on the front line. And that's, for me, I think one of the great lessons that we've learned through this COVID pandemic. It's about the families, it's about the friendship, and it's about that engagement on the ground. So well done. You also mentioned, I suppose, Brenda, you said that when we told people we could do it, then we had to deliver. So I think there was a demonstration there of the agility, like maybe we were all afraid that we weren't going to be able to step up and do it, but we did. And I think I'm back to that, the agility, the collaboration, the volunteerism. We should never lose that now. We should continue to maintain that progress and pace. And I know that's not easy, but I think we should continue to do it. So thank you both for that. I suppose just a couple of things I just wanted to put out there, and I think probably pretty much everybody was kind of feeling this way, but these are things that I missed greatly during the pandemic. I missed the sound of laughter and fun. Being in a room, loads of people having to shout and roar over each other just to be heard, and the laughing that goes on in the background. So we need to get back to that. I didn't realise I was a hugger, but actually I really miss hugging people. So I'm really looking forward to getting back to a stage where we can just throw our arms around people and not be thinking about it and being self-conscious about it. And then I suppose another thing that I was out last week for the first time in a long time, and I realised that I was missing those kind of, you know, the dual and triple conversations that you can have in a crowd. So you could be talking to one person and then you're hearing something else, you move to that conversation. And then before you know it, all three conversations are all rolled into one. We kind of, maybe we've lost that art and we probably have to work at it a bit. So we need to help each other, I think, to do that. So again, it's all about the agility, the collaboration and the volunteerism. And before I hand back to the chair, I hope you don't mind, but I know for a fact that Brenda and the team have done fantastic work over the last couple of years, but you've always done fantastic work, to be fair. And I was always proud to be a board member on Cork City Partnership. So well done on that. But I would like to make special mention, if that's okay, and just to say to Jackie Sweeney, You work away really quietly there in the background, but you do incredible work, and it is down to your support and your dedication that events like today take place. So thank you all for indulging me, and I'll hand back now to our chair. Thank you.
Thanks, Adrian. So just before we close off the event today, I just want to say thanks to, first of all the staff and Cork City Partnership for organising the event, particularly Brenda and Jackie, to all the contributors today, and in particular the Lord Mayor and the Minister for attending. So on that note, we'll say goodbye and stay safe. Thank you very much for everybody for taking part.